Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the proptosis, we have unilateral, painful, non axial or non central proptosis. That is peripherally. The proptosis is present to the one side. Like, for example, if there is a tumor here, this can push the proptosis or the eye to this side, causing proptosis. So, that is unilateral, painful, non axial, or non central proptosis. This is mainly because of the tumor, because that can push the eye to one side. So, it can be due to adenoid cystic carcinoma of lacrimal gland, nasopharyngeal carcinoma, and metastasis will result in unilateral, painful, non-axial or non-central proptosis.
thank you and thank you for watching.